So excited. Good morning, everybody. I'm Neeli Bendapudi, President of the University of Louisville, and it's my great honor today to welcome you to the University of Louisville and to our Cardinal Stadium vaccination site. We are so happy, so grateful, so honored to work with the state, the city, and this community to open this mass vaccination site, the largest site in the Commonwealth. Beginning today, hundreds of medical professionals and volunteers will vaccinate up to 4,000 people a day for the next 7 weeks. This means during this period, we have the ability, the will, and the skill to vaccinate up to 200,000 people. It'll make a huge difference in our Commonwealth's fight against COVID. I'd like to first thank Governor Beshear for his leadership that has been steadfast, rational, effective, and has set up Kentucky as a national standard in addressing the pandemic. Governor, thank you. I'd also like to thank Mayor Fischer for his efforts to ensure that our community is at the forefront of testing and vaccinating our citizens. Thank you, Mr. Mayor. And of course, you have to allow me a point of personal privilege and pride in saying a public thank you to Tom Miller and Jason Smith, our own Tom Miller and Jason Smith. Thank you for your tireless efforts to reach out to all the citizens in this community, and particularly those who are in underserved areas. While this is the biggest site we have launched, I want to point out that Tom and Jason and have led other efforts to vaccinate people at our downtown site, locations throughout Louisville Metro, and of course, significant efforts in the West End. And now, I have to thank our healthcare professionals and volunteers. When you see them, please just shout out thank you. No hugs, no handshakes yet, but please say a big thank you to them. They have been working for months to test and vaccinate so many people from Louisville and throughout the Commonwealth. The work that they are doing and continue to do is making a real difference for Kentucky. This site is a perfect example of why it's important to have a premier research university in this metropolitan setting, in this Commonwealth. U of L Health physicians, nurses, other personnel have played a lead role in testing and vaccinating and treating patients. Our researchers continue to develop and test potential preventative compounds and other treatment options. Yet others of our employees have created and distributed PPE to protect our frontline workers. Very few institutions across this entire nation have the expertise and the commitment to handle such a large task as this vaccination site that you see today. We are honored to host this vaccination site, and we look forward to supporting and working alongside the state and the city to fight this pandemic. And now, for everybody who is listening, please, for us to get back to normal, for us to be able to do all the things that we miss and we enjoy, please get the vaccination, encourage your family and friends to do so. With that, I'm now ready to introduce somebody that I'm proud to say is one of the heroes of our university, the CEO of U of L Health, Tom Miller. Thank you.
Thank you, Neeli, and let me first of all just thank you for your vision and ongoing support of U of L Health, and thank you for being a champion for equity, diversity, and inclusion in our community in this Commonwealth. You are truly making a difference. If you don't mind me, Neeli, I'm going to quote one of our football coaches who say, "Go big or go home." There is no doubt today that we're going big in regard to trying to make a difference in vaccinations in this community. I'd much rather see this lot being used for football games this fall, but today there's no better purpose than trying to reach 200,000 vaccines over the next 7 weeks. I want to personally thank the governor for his commitment. He has been at our vaccination sites many times and trying to support the community and encouraging people to come out, and also Mayor Fischer in regard to the Commonwealth. You don't know all the work that Mayor Fischer has been doing behind the scenes. It takes a tremendous effort to try to make a difference in this community, and I want to personally thank the volunteers that are here from AmeriCorps, from the Kentucky Air and Army National Guard, and for the University of Louisville Medical School students. We chose this site to really make a difference because it has great access. And as you can see from the cars that are coming through, we hope we can get people through in about 10 minutes. There's 28 lanes here, and so a great opportunity. What I would ask all of you to do is, if you know somebody who's not been vaccinated, if you know a business that needs help, have them call, set an appointment, or just come by. We've got lots of vaccines for everyone. It's my honor now to introduce our great governor, who truly has made a difference in the health of the Commonwealth. He has been an advocate for being safe. He's been an advocate for the healthcare providers, and he is our partner in trying to make a difference in this community. Governor Beshear.
Good morning, everybody. I want to thank Tom. I want to thank Neely. I want to thank Mayor Fischer. I want to thank our two representatives that are here with us today, Representative Wilner and Kulkarni. I want to thank Jason, Doc, who is our very first vaccinated individual in Kentucky. I want to thank U of L and the City of Louisville for being such incredible partners for Team Kentucky. How big is this? Look around. How big is this? We're here at Cardinal Stadium in Louisville, ready to open the most ambitious vaccination operation to date. This is just the next step, even though it's a big step, in our successful rollout of the safe and effective COVID-19 vaccines. I am standing in the midst of 28 drive-through vaccination lanes. Together with our partners at U of L Health, that means we'll be able to administer up to 4,000 vaccines a day, 200,000 overall. Those are so many shots of hope that are going to help us finally defeat this evil virus and put it behind us. This, what you're seeing here today, these cones, these cars, all these incredible people, the National Guard, AmeriCorps, U of L, this is how we will win this war. Cardinal Stadium is, of course, the home turf of the University of Louisville Cardinals. While the red and black enjoy the off-season, we're here today, everybody united, to cheer on Team Kentucky. And right now, we need everyone to rally us to victory. We deserve a victory. We all deserve this victory after a long, difficult year where we all fought so hard to protect one another. Since March of last year, we have faced so many challenges, but we faced them with action. We started with decisive action, crafting targeted guidance to protect our people's health and safety, and we have always made sure that protecting one another is at the forefront of our decisions about what we do. We built out a statewide COVID-19 testing program from scratch. We built up a reliable 120-day supply of personal protective equipment. We saw Kentuckians everywhere, leading with compassion, making sacrifices to protect one another, showing us the very best of who we are. And while we have lost so many, and we have lost so many, people that I know, people that you know, we're at the point now where everybody has been impacted. We have experienced dramatically less loss of life than just about every other corner of America. And we face less disruption than most in continuing to live our lives the best we can at a time when this virus can jump from one person to another, and ultimately end the life of the last person in that chain. Think about it. As we sit here today, we have pushed back, we have repelled 3 surges of this virus that have come for our people. And now with these modern medical miracles, and that's what they are, a year and a month into this pandemic, 3 highly effective vaccines, over 1.5 million Kentuckians vaccinated, folks, that's a miracle. We're making a difference. And it's allowing more and more people to get together and to do things together. About 2 weeks ago, my parents got to hug my kids, their grandkids, for the first time in 14 months. That is worth the vaccination. That is worth all of us getting those vaccinations. And we see leaders in Frankfurt working with us in this administration on how we move forward and how we emerge. Most recently, a bipartisan agreement in how we spend the American Rescue Plan Act funds to help us sprint out of this pandemic, stimulate our economy, compete in the post-COVID world, and not fall back into what we have had to survive. As we sit here and look at all these cars, this is the greatest traffic we will ever see in our lives. We have a light at the end of this tunnel. And this light are these vaccines, the use of those American Rescue Plan Act dollars that are going to create over 14,500 jobs, our chance at a brighter future and broadband for every single part of Kentucky, clean drinking water for every single part of Kentucky, rebuilt schools, resurging, being better, creating opportunities that maybe we never thought were possible. We are poised to win, and we are poised to come out in a better place. But to do that, we've got to defeat COVID. So let's end this pandemic by getting our shots of hope. Since December, when the first doses of Pfizer vaccine arrived just a few miles away at UPS Worldport, we've been sprinting towards that victory. In fact, I was there when Dr. Smith became the very first person in Kentucky to receive his shot of hope in December, and he is here not only healthy, but showing up every single day to treat other patients with that protection these viruses give you. We prioritized our healthcare heroes who have risked their lives to protect so many of us. We put our most vulnerable residents, those in long-term care, in the front of the line, and guess what? It's working. With fewer and fewer cases and our deaths dramatically decreasing in long-term care, going from about 67% of all deaths now to down under half and decreasing every day. We made sure our older Kentuckians were never forgotten, and we led the country in prioritizing our teachers to get our school systems open, doing it before any other state. Our gains are real, and we ought to celebrate them. But the tough news is this crisis is not over. After weeks of sharp declines, most states, including ours, are seeing a plateau in number of cases and number of deaths. But even more concerning, 4 states and many foreign countries are seeing a 4th wave of surging cases. This wave is driven by a more difficult strains, alarming variants of COVID-19, such as the B.1.1.7. That is the UK variant that the CDC now says is the dominant strain across the United States. Concerning to a parent like me, it's infecting more young people, and it's putting more young people in the hospital. I mean, they are getting sick at a more alarming rate than we have seen at any point in the pandemic. So, how do we defeat this virus? How do we get back to normal? And how do we make sure that there is not a 4th surge in Kentucky? 2 things. We get our people vaccinated, and we continue to wear our masks and to do the right thing. We've opened eligibility now to everyone who qualifies. Every single Kentucky adult is eligible to get a vaccine, and even 16 and 17-year-olds can sign up right now to get the Pfizer vaccine. They can get that vaccine right here in Cardinal Stadium. At this location, we also have worked to make sure these life-saving vaccines are administered in a fair and equitable manner. This site was chosen both for its central accessibility and close proximity to the medically underserved areas of Louisville. Being able to administer 4,000 vaccine shots a day doesn't happen without all the teamwork that you see behind us. This is truly an example of so many people coming together. Again, thanks to U of L, thanks to the mayor, thanks to so many that are working to make this happen. I also want to thank our medical partners and our media partners for getting the word out. We've all lived through the difficult times of this pandemic, and we all win or we all lose together. So please, to those in the media, make sure you keep pushing out where people can get these vaccines. We still have a lot of openings later this week right here. People can get in, get out, they can get on and sign up right now for an appointment this week. You and everyone else are helping us to win this pandemic. We're boosting capacity across the state. There are now clinics in every single community. No matter where you live, you can likely get a shot of hope in the next week. All you got to do is get online or pick up the phone and sign up. And we need all Kentuckians of all ages to be doing it. Now, we have to continue and even accelerate our pace of vaccinations. So on that note, I'm going to make what at least I believe is a pretty big announcement today. Today, I'm announcing our Team Kentucky Vaccination Challenge. This is a challenge that directly ties our number of Kentuckians that get vaccinated to the end of most capacity restrictions we have put in place to date that we have implemented to protect Kentuckians. Our first goal, our big goal, is a threshold of getting 2.5 million Kentuckians at least their very first shot of hope. When we do, when we have vaccinated 2.5 million Kentuckians, we will remove capacity restrictions for nearly all venues, events, and businesses that cater to 1,000 or fewer patrons. And this goal, when reached, we will remove the physical distancing restrictions and we will end the curfew that we have on bars and on restaurants. So, to be clear, we should all be motivated right now. If you are a restaurant, a bar, a store, a public pool, a country club, a grocery, a funeral home, a wedding venue, a concert hall, a museum, if you put on festivals, if you are a distillery, this is what you've been waiting for. A clear number and a clear goal to hit, where yes, while we'll still wear masks until we have control over this variant, and while the major events we will still have to address in different ways, this is when you know those capacity restrictions will end. So, we're asking each of you to do your part. Make sure if you're a restaurant that your entire staff has been vaccinated. Make sure if you are a business, a retail location, all of your staff has been vaccinated. Reach out to your customers. Reach out to those that want to get back to normalcy. This is the way, and this is the number. And as of right now, we're just a little over 900,000 Kentuckians off of that mark, with, we know, over 1.55 million Kentuckians having received their first shot of hope. But with our current supply, with what we have out there, folks, when will we hit this goal? It could be in as little as 3.5 weeks. Realistically, it's probably going to be somewhere between 4 and 6 weeks, but it is all up to us. Every single individual's choices can get us closer to that normalcy we've been looking for. So here's a goal. You know, in Kentucky, we like knowing what it takes to win. I know the Cardinals and everybody else do. So this is how we do it. Let's make sure we get out there, and let's make sure we get vaccinated. And remember, you can always go online to vaccine.ky.gov, because this isn't the only location. I had people reach out to me from Nelson County the other day. I found them 4 locations in their county where they could sign up within 2 days. It is that easy. Employers, people in tourism, people in sports, this is our chance to make it happen. Those are the personal efforts that it's going to take. So Team Kentucky, let's get out there, let's win, let's get these first 2.5 million Kentuckians vaccinated. Let's end the capacity restrictions on most organizations, venues, restaurants at that point. And then you know what? We'll only move forward from there. Thank you. God bless. And now I get to introduce someone who has been a great partner in fighting this virus, that has led the largest city in Kentucky, one that's experienced a significant amount of loss, but has seen so much success. Again, a wonderful partner that we have had in this effort, and that is Mayor Greg Fischer.
Thank you, Governor. Good morning to everybody. Thank you for coming out to this amazing new facility that we have here. Dr. Pendapudi and Tom Miller, I want to thank you, to your team here at U of L. Dr. Jason Smith, if there's one person that's kind of represent the tenacity and hard work to beat this virus, it's you. So I really appreciate all the things you've been doing, from being, I guess, we call you patient zero, or patient zero, to now mass vaccination site. But if you go into our neighborhoods with our vulnerable populations and you see vaccines being injected, he's right there too. So I mean, it's just been an incredible amount of work that I've had the honor of observing over the times. A lot has been said here, so I won't repeat that, but this is an exciting inflection point for us here in Louisville and in Kentucky to say, okay, folks, we're getting to the point where we've got at least supply and demand being equal, if not more supply than demand right now. So if you've been thinking about it but not quite sure how to get a vaccine, your answer is here with this mass vaccination site. And the opening of this site is a continuation of U of L Health's commitment to equity and the community as well. They have been an amazing partner throughout this journey. When you think about what's been done in a relatively short period of time, U of L has partnered with us to open drive-through testing sites, pop-up vaccination sites with local churches, opening vaccination sites in underserved communities, ensuring the vaccine is delivered equitably and available to our most vulnerable residents, and the groundbreaking science work and research that they're doing at the Envirome Institute with the Co-Immunity Project with wastewater detection of the virus. This is going to be a very critical aspect, science aspect to us when we're trying to identify how we can get to herd immunity. When we need to put more vaccines in areas of the town that still have prevalence of the disease. And the wastewater detection of the Envirome Institute is going to help us do that through their sewer shed technology. So that's going to be a big deal for us and a good story for one of you all in the media. I want to give a big shout out too to our Metro Public Health and Wellness team. Dr. Sarah Moyer, Dr. Sarah Beth Hartledge, Bill Altman, and their staff who've been really working tirelessly since the first known COVID case in Louisville, which now has been a little bit over a year ago, from going to understanding what was going to happen, to testing, to vaccinating, all these many steps of the way. And then the opening of the mass vaccination site, just a mile from here. We call it LouVax at Broadbent Arena. You all have been there. It's been a national model of efficiency, as highlighted in the New York Times and the Wall Street Journal. And then we announced last week that because this virus is tricky, look, the virus's job is to find people that have not been vaccinated. When the governor talks about more kids getting the virus, why are they getting the virus? Because the virus's job is to find them, because the virus just wants to keep living. So we got to be flexible on how we fight this virus as well. So LouVax from Broadbent is going mobile over the next few weeks. Now we're going to make sure that everybody's gotten their shot at LouVax at Broadbent is going to be able to get their second shot as well. But we're moving more intentionally into the community to scale these micro responses. We've already seen success with LouVax Mobile, with missions to some of our most vulnerable residents, our homeless population, seniors, some residents of our international communities. We're really ready to scale as we've coordinated 21 mobile missions so far in providing safe, effective vaccinations. Main thing to people that are thinking, should I get this shot? Just know it is safe. Okay, clinical trials of hundreds of thousands of people. It has now been administered to hundreds of millions of people around the world. So if safety is your concern, you can just look at all the people that have received the vaccine and say you can get rid of that as the concern. Because we need you. We need you to get to herd immunity so that you can hug your grandkids and you can go to your favorite restaurants and come to ball games. And we couldn't make all of this happen. I want to thank another group of people without the incredible volunteers that are helping us here, that have helped us at Broadbent, and that are helping us with LouVax Mobile as well. Compassion is the heart of our city. We're always trying to lift other people up, and our volunteers in this COVID effort really exemplify that spirit of compassion. So we're far ahead of the game in terms of vaccine supply and capacity compared to the predictions. Remember, a month ago, 3 months ago, it's like, we need more vaccine. We need more vaccine. We got vaccine now. Now, it's up to our people to do, I think, their duty as citizens, their patriotic duty, as Americans as we fight this disease together. We need you to come out and get your vaccine. So we're so close to the end now, we got to stay focused. It'd be like if we were back here at Cardinal Stadium, you know, we can see victory in sight, but the clock is running down. And the last thing you want to do is lose focus when you see victory in sight. And that's where we're at with this virus. But if we lose focus, it's going to be a challenge that's unnecessary for us. So please, I encourage everybody to get your vaccine, continue to wear your mask. It's a small price to pay for the benefit that's going to come here in just a couple months. And then in conjunction with this great announcement from the governor here today on the milestone we need to release these restrictions that so many people dislike. With that, please let me introduce Dr. Jason Smith from U of L Health. As I said, he's an incredible physician, he's an ER doc, but he's an incredible entrepreneur that's pivoted his responsibilities to scaling up U of L Health's response to the virus with this incredible vaccination effort, and his ability to motivate folks, whether it's 1 or 1,000, is here. So Doc, we're just so grateful you're a member of our community. Please welcome Dr. Smith.
Well, thank you all very much. I'll try and keep this brief. I want to thank everybody who's out here today from the media to help get the word out about what needs to happen. And I want to thank everyone here who's working, from the volunteers to the National Guard to the Army to our healthcare staff. I would like to thank Dr. Hugh Schoaf for what he has done from the operations standpoint. Lauren Hicks and Haley Davis has helped us from the operations standpoint. They used to run our vaccination location downtown. They've moved up to this and are helping us scale this up for the Commonwealth and for the city of Louisville. We've got 28 lanes here, and one of the important things I remind people is it takes 10 minutes. From the moment you hit the front door of this location to the moment you get your vaccine is 10 minutes. That's all it takes to save a life. That's all it takes for you to be a valuable member of this community, is 10 minutes. We've made this so that it doesn't interfere with you. It doesn't interfere with what you need to do go about your day. But you can stop this virus in its tracks. And so I urge everyone who can hear this to please come down. Take advantage of this site while it's here, while it's open for the next 2 months. Help us stop this virus in its tracks. If you look across the country right now, there are states that are contemplating shutting back down. Michigan's one of those. Speaking with colleagues over the weekend from Michigan, their ICUs are now beginning to fill up again with a much younger patient population. They're still sick. They're seeing an increased number of tests, an increased number of hospital admissions, and unfortunately they're going to be seeing an increased number of deaths in the upcoming weeks. That's the simple fact of the matter. So the more that we can do today to stop this virus in its tracks and get the vaccines out, is the better that we can respond as a community and as a state. I want to thank everyone who's behind me, who's backed this up. I'm simply one person standing in front of an army of individuals who are here and dedicated to the health of this state and to this community. And so I urge everyone who can see this, please call, get on our website, and if you can't do either of those, just show up. We'll make sure you're registered. We'll get you your vaccine as safely and efficiently as we can. So thank you all very much for everything you're doing. Thank you for getting the word out, and thank you for everyone who's supporting me. So, thank you.
We're going to open up for questions in just a second, but I want to first of all thank Dr. Bandiputi for being here. I will tell you that the university doesn't get credit for the worldwide research that it's doing to try to fight this virus. Governor Beshear, thank you for your inspiring thought in regard to how to make a difference and be part of Team Kentucky. We can reach $2.5 million, 2.5 million vaccinations, and hopefully we will see herd immunity. Mayor Fischer, thank you, and the Department of Health for all they're doing in trying to drive this locally. And Jason Smith, he was patient zero, but let me tell you, we did 1,000 vaccinations at one of the churches locally, and he's organized about 30 churches, and he says we can do more. We can do more, and he keeps saying we can do more, which is what drove us to being here today. So let me again thank everyone and thank all of our volunteers, and we'll open it up for questions.
So 2.5 million, which is our goal, is about 70% of Kentucky's population that right now is eligible to get the vaccine. When you look at 16 or 18 and up, At that point, what we will do, and there are some exceptions, is to end capacity restrictions. But that doesn't mean we're going to stop wearing masks or following some other guidance at that point. This is our first goal, a goal to hit to do that yes, Dr. Stack and others, I was talking to Dr. Smith, believes is the right time, the right incentive, and a goal that will keep us safe. As we sit here today, and I'm still waiting on some clarification of numbers from yesterday, we know we vaccinated about 1.55 million Kentuckians with at least their first shot of hope. That means we have about 950,000 Kentuckians to get vaccinated to hit that goal. Now we've got, as we sit here today, more than 400,000 vaccines that are currently out there ready to go into people's arms right now. We're getting about 250,000 a week. And so we can definitely get there. Now, to get there, one thing that we're going to need people to do is to get the vaccine that's available to them. Because of Johnson & Johnson's manufacturing issues, the amount that we have of that is flat. We were hoping to have, 30, 60, 70,000 J&J doses a week. We have about 7,000. And so we know there are some people out there that would prefer it, but getting to herd immunity, protecting each other, we need them to go ahead and get that one. I'd also be remiss if I didn't thank the National Guard for all their work. It seems that between the flooding and the storms and everything else, I get to be with the National Guard every day, and they do a great job, especially here at these facilities. Is there any regret not opening this sooner? As we look back, I think that we have hit the demand that's been out there each and every week. When you look at, if you go back more than 2 weeks, we've been over 100% each and every one of those. So I think that there is, a time and a place depending on supply and demand. I'm certainly really excited about this. It is the right timing with where the variants are. But what we're really going to need to do is push people here. We still have thousands of appointments open this week. So I believe the timing is generally right. We've been able to get through Broadbent and others 100% of the supply that we've had into people's arms. Now we got more supply. We just need more people. So we're working. The question is plans on getting to younger adults. We're working every day on being creative, on different incentives and different opportunities. Part of what we need them to do, though, is to know that these current surges, look especially in Michigan, are hitting younger Kentuckians. I don't think we are to the hesitant or those that are going to say no. I think we're to the indifferent stage. People that would be willing to get it if it's easy or if there's a compelling reason. It's one of the reasons that we are going to end some of our, especially Kroger, mass vaccination sites and push them to more Kroger stores, more independent pharmacies, and others, trying to have this vaccine where you go in your everyday daily lives. If you're going to get groceries, stop off and get your vaccine. If you're going to pick up other prescriptions, stop off and get your vaccine. And again, we're willing to be creative and go wherever others are. I know we were having just some initial conversations, U of L, thinking creatively about how to incentivize and encourage their students to get the vaccine, because certainly right now there's a huge group of Kentuckians, really 16 to 30, that this has just been open a couple weeks. And we've had a couple spring break weeks that I wish so many people hadn't traveled, but they did. But now they can get vaccinated and make it up to me. All right. Thank you all very much.